Hi, everybody. Thank you so much for joining us this evening. I hope that you and your loved ones are safe and healthy during these very challenging times. I'm State Senator Jason Lewis, and I want to welcome you to our community conversation, delivering on the promise of a COVID-19 vaccine in Massachusetts. The COVID-19 virus, as we all know, has had a devastating impact on our state and on our country. More than 270,000 cases have now been confirmed in Massachusetts, and tragically, more than 11,000 of our neighbors have lost their lives. The pandemic has also upended our economy, leaving many people out of work and posing huge challenges for our hospitals, health centers, schools, universities, municipalities, our small businesses, nonprofits, and others. As we now approach a holiday season where we will have to modify or forego travel and beloved family traditions, there is finally a light at the end of the tunnel. Both Pfizer and Cambridge-based Moderna have rapidly developed COVID-19 vaccines that either have received or are soon expected to receive emergency use authorization from the FDA. In fact, the first Americans to be vaccinated received the first of two required shots earlier today. But many questions and challenges remain. In a recent Massing poll, only 36% of Massachusetts residents said they would get a vaccine as soon as it's available to them, while 47% said they would wait until after other people have received it, and 7% said they would never take any vaccine. There are also significant racial differences, with Black and Latinx residents more wary than white people. Two of the biggest concerns among those reluctant to get vaccinated are whether these vaccines have been thoroughly tested and concerns about fully trusting the government on healthcare issues. So that brings us to our discussion tonight. Sharing timely, accurate, and trusted information with the public will be crucial to the successful implementation of the largest and most ambitious vaccination campaign in our history. We are very fortunate to be joined by three terrific panelists: Dr. Ann Bruno-Murtha, State Senator Cindy Friedman, and Kristen Lanphere. They will help us better understand the science behind the vaccines, their safety and efficacy, and how and when they will be distributed to all residents in the Commonwealth. So let's get going. First, I'd like to welcome back Dr. Ann Bruno-Murtha, who, as some of you may recall, was a panelist on one of our previous forums earlier this year. Dr. Bruno-Murtha is a board-certified internal medicine and infectious disease physician and an assistant professor of medicine at Harvard Medical School. She serves as the division chief of infectious diseases at Cambridge Health Alliance. Okay, there she is. Dr. Bruno-Murtha, it's great to have you back with us.
Thank you, Senator. It's great to be back.
So could you please kick off our discussion by covering some of the basic health questions that many people have, such as how these vaccines actually work, how effective they will be in preventing a person from contracting COVID-19, how safe they are, and of course, whether we will be able to return to a normal life once enough people have been vaccinated.
Thank you, Senator Lewis. So I will answer all of those questions. And really my goal tonight is to increase your comfort level in the vaccine so that when you are able to receive it, you have the same confidence and, in fact, the same enthusiasm that I have to receive the vaccine. And I would strongly recommend that everyone take this vaccine. And if you're not ready, we will help you get ready. There is a vast amount of information available so you can educate yourself in layman's terms to understand how the vaccine works. We know, based on the published clinical trial of the Pfizer vaccine that was actually published online last Thursday evening in the New England Journal of Medicine, shortly following the full day panel hearing at the FDA with the independent advisory board, that the vaccine showed an astounding efficacy of 95% in preventing COVID-19. And in fact, it was also effective at preventing serious COVID-19. The phase 3 clinical trial that Pfizer undertook and Moderna is presenting their data this coming week before the FDA also is very exciting in that it protects against disease and serious disease. What we do know of work is both the Pfizer and the Moderna vaccine are what's referred to as an mRNA vaccine. And what that means is that the vaccine has a small segment of RNA that is basically the instructions for our cells to produce the spike protein. When our cells produce that spike protein, it then triggers our immune response to produce antibodies to the spike protein so that after we're vaccinated, if we were to become infected with the SARS-CoV-2 virus, our body will have the antibodies present and will actually be able to produce additional antibody under the presence of the virus in our body to combat disease. There's also some evidence that it enhances protection by other immune mechanisms beyond antibody production, and specifically enhancing our T cells and our memory T cells and killer T cells. So it's very exciting in terms of a very robust immune response. The genetic material is actually encoded in lipid. And the reason why it's encoded in lipid is because our body would otherwise destroy the instructions to produce the spike protein before it was able to reach our cells. The RNA does not reach the nucleus of the cell where our DNA is. So it is not possible that this RNA gets encoded in our DNA. It is also not possible to get COVID from the vaccine. It is not a live virus. It's merely a small piece of instructions to our cells to produce the spike protein, the same spike protein that's on the surface of the virus, so that our immune response can protect us from infection. These vaccines will be very effective, but they'll only be effective if the majority of the population gets vaccinated. If we have a great vaccine, but we don't adopt it, we will go on and having to contend with our life as it is right now. Wearing masks, socially distancing, not being able to celebrate holidays like we typically would. So it's very important that we increase everyone's confidence that the vaccine is safe and effective. In terms of safety, what do we know? I'm very excited to say that with the publication of the Pfizer data and the preliminary data for the Moderna vaccine, we know both of these vaccines have been studied. There are between 30,000 and 44,000 participants in the clinical trials. They've been reviewed by data safety monitoring boards. They've been reviewed or will be reviewed next week by an independent panel appointed by the FDA to review the safety data and vote on whether the vaccine should be adopted and authorized as an EUA approved vaccine. And this only happens when the safety data is reassuring and there's no concerning safety signals. In addition to that, the Advisory Committee on Immunization Practices, another independent panel appointed by the Centers for Disease Control, is another body that ensures that the vaccine is safe, and they ultimately decide how to best issue the vaccine and which populations should be targeted initially. And as you probably know, the first groups of people that will get the vaccine will be healthcare workers and residents of skilled nursing facilities. That's based on the ACIP or the advisory panel uh, for immunization practices. It's based on their recommendations because these are the groups that they deem most at risk for infection with this virus. In the Pfizer study, there were no serious safety concerns demonstrated, and this was thoroughly vetted. Similar process will happen with the Moderna vaccine, which is going before the FDA this coming week, and additional platforms that are likely to be before the FDA in the coming months. We do expect some local reactions at the site of the vaccine, so you will get a sore arm and mild swelling and mild redness. That's expected in really more than half of the vaccine recipients, not much different than other vaccines like the tetanus shot or the shingles vaccine. And we do know that after the second vaccine, local reactions and some more systemic reactions like fatigue, muscle aches, chills, joint pains, and in some cases, fever can occur. These more systemic side effects that are reported are as a result of our immune system responding to the vaccine. It's our immune system actually producing antibodies that is causing us to have some of these symptoms. And they can be treated with analgesics like Tylenol or like nonsteroidal anti-inflammatories. And they are short-lived, about 1 to 2 days. They will not happen in everyone. They tend to occur more so in younger populations than in older populations. And this is something that it's important to expect some of these side effects, but these are not serious side effects that should deter us from being enthusiastic about developing immunity so we do not get sick. We will not be able to resume life as we know it immediately. It will require ongoing patience and vigilance because we need to wait for the majority of the population to be vaccinated before we stop utilizing all these public health measures. Another important point is we do not yet know, we will know soon, whether the vaccine actually prevents asymptomatic shedding of the virus, as well as whether it prevents contagiousness. These are things we don't yet know that are actively being studied, and we should have that information shortly. I will stop with that, and I look forward to your questions.
Thank you so much, Dr. Bruno-Murtha. That was a fantastic overview of how the vaccines work and safety and efficacy. Lots of questions I'm sure you already answered. Just for the benefit of our audience, where you have 2 more panelists who will sort of give introductory remarks, and then we're going to leave lots of time for your questions and discussions. So feel free to start typing questions, into the Facebook comments. We're going to try to make sure we get to as many questions as possible. We're going to go till at least 8 p.m. tonight, so we should have plenty of time. Great. All right. So our next panelist is my friend and colleague, Senator Cindy Friedman. So let's bring up Cindy. There she is. Senator Friedman represents the 4th Middlesex District, which includes Arlington, Billerica, Burlington, Woburn, parts of Lexington. So she's really our neighbor. She serves as the Senate's chair of the Healthcare Financing Committee, which is the main Senate committee responsible for healthcare policy. And Senator Friedman's also a member of the Massachusetts COVID-19 Vaccine Advisory Group, advising Governor Baker and his administration over the last several months. So Senator Friedman is well positioned to talk about how we're going to now execute on the vaccine plans for the state. Senator Friedman, thank you so much for joining us. Great to have you.
Hi, Jason.
Why don't you help us understand how Massachusetts is planning to distribute the vaccines, obviously the Pfizer vaccine first, but then Moderna and perhaps others. Which groups of people are going to be prioritized? When will people be getting access to the vaccines? And, this is a mammoth undertaking. How are we going to sort of manage all of the logistics for such a huge vaccination campaign?
Sure. Well, this is a pretty exciting time. This is, many people have been waiting for this for quite a while. And even though it feels like a long time, this has been an extraordinary, fast production of a very important vaccine. So your first question, or how are we planning to distribute the vaccine? So the state has developed a vaccine distribution plan and a timeline for that distribution. It was developed with extensive input by the COVID-19 Vaccine Advisory Group, which is made up of leaders from healthcare, the faith community, community organizations, local government, and others. I felt very honored to be asked to be on that committee. The plan reflects several priorities. The overarching priority for us was to maximize benefit and minimize harm. And what does this mean? It means that we need to protect our most vulnerable residents. It means we have to make sure that we maintain our healthcare system so that it can continue to treat people who are ill. It has to be sure that it addresses any inequities in the healthcare system that are to date, and those inequities turning into access issues to get the vaccine. And it has to do it in a very thoughtful and efficient way. Also, the plan acknowledges the reality that this vaccine is not going to just show up tomorrow and everybody's going to be able to get it. It's coming out, it's rolling out now. I think the first week or two, we're going to see about 60,000 doses. And then that will slowly ramp up. When Moderna comes on, we'll have some more. But we're really only looking at about 300,000 was the last count. And I know it's going up and down. So, it changes, but we were looking at about 300,000 doses by the end of the year. So what do you do when you have this limited dosage and you want to roll it out in a way that meets your priorities? So that's how we came up with the phasing. I think that Dr. Bruno-Murtha alluded to. So the first group of people that are going to be vaccinated are the clinical and non-clinical healthcare workers that do direct face-to-face care with COVID-19 patients. So we're looking at hospital workers who are doctors, nurses, environmental services, food, all of the people, anybody that has direct care with COVID-19 patients. This is for obvious reasons. They are the sickest, and we need the healthcare system to be protected so that they can continue to take care of all of us. Also in that first phase is long-term care facilities, rest homes, assisted living facilities. So the residents and staff that work in those areas. Well, then police, fire, and emergency medical services are in that first phase. As well as congregate care setting, people working in congregate care settings. Then home-based health workers will be in the first phase. And then healthcare workers doing non-COVID facing care. So doctors' offices, people that are in healthcare, but they aren't directly dealing with COVID people. And just to give you an idea of the numbers here, clinical and non-clinical healthcare workers that have direct care That's estimated to be roughly 200,000 people. So that's 200,000 doses right there. So you can see why it's just really important to have a phased approach to this. Phase two, which we believe will start somewhere in February, maybe early February, are individuals with 2 or more comorbidities. So they have a high risk for COVID-19. Maybe they have heart issues or high blood pressure or diabetes. We'll also be including early education workers, K through 12, transit, grocery, all of the essential workers that are not doing direct care, but provide essential services. Adults 65 and over will be in that group, and then individuals with one comorbidity. And then the final phase is the general public. It's just, all the rest of us who don't fall into those categories. And again, this timeline is subject to change. It has to do with, how fast the labs can produce the vaccine. But that's what we're planning for, and that's been pretty consistent since the start of this. The second question that you asked was, how will this be undertaken? Well, the federal government, in its wisdom, is going to pay for the vaccine, but they're really leaving it up to the states to manage the distribution, the rollout, the implementation of the vaccine process. And that's what the state has been doing for a while now, is to build that system. And what it generally is going to look like is the early dosages, the early vaccines, are going to go to hospitals who are more than capable of being able to get it out to their workers. At the same time, the federal government has a contract with CVS and Walgreens to deliver to long-term care facilities. So CVS and Walgreens are going to keep their own stock of vaccines, and they will be delivering them to sites. And this is something that we have to pay attention to, because we're not quite sure how that's going to work, because it's not completely a state function. So I know there's a lot of work to get some visibility into that. And then the Department of Public Health is also starting to build a system within their local public health entities to develop the plan for getting those vaccines out into the community. And that will probably will definitely take some work also, probably from private sector actors who can help to deliver that in communities, especially because we have 351 communities and not all of those have a local health department. So that is what's being worked at now. And that's certainly something that needs to be ready probably by mid-January, I would assume, up and running, and we understand. We're also using the state systems to track the vaccine so that we know who got it, where they got it, when they got it, when they need to come back and get the second one, because remember, it's 2 shots right now. And so it's a real logistic task to make sure that we could get that person, you, Jason, to come back when it's time for you to get your second shot, and we know what you got. If you got Pfizer, you need to get a second shot of Pfizer. If you got Moderna, you need to get a second shot of Moderna. So that's all what's being worked at now. And I think there's a lot of planning in place. And that's one thing that the legislature is going to be doing is tracking that very carefully. I do want to say that this is really exciting, but the preparations, what we're doing, cannot change the way we act for a while. So as the doctor referenced, we need to wear our masks, social distance, wash our hands. We've got to be vigilant about that, because it is going to take a while to vaccinate enough people so that we now have that, I think, what people call herd immunity. So those are the plans right now. And, we'll we'll keep at it as things evolve.
Great. Thank you so much, Senator Friedman. That was a fantastic overview of how this is all going to be rolling out in the Commonwealth. And I know lots of questions are coming in, so that's great. We were expecting that. Our third and final panelist this evening is my pleasure to welcome Christian Lanphere. Christian is the hospital administrator for the CHA Everett Hospital, and he's the Senior Director of Emergency Management and Safety for the Cambridge Health Alliance system. He also serves on a number of different healthcare boards and commissions. So Christian is really the point person, what Senator Friedman was talking about in terms of hospitals being in the first wave of getting the vaccine out. That's what Christian is eating, breathing, and sleeping, although he's probably not sleeping very much right now. So he's the exact person to hear from on how this is happening on the ground as we speak. So Christian, perhaps you can help us understand how at least one hospital system, Cambridge Health Alliance, is planning to vaccinate, thousands of staff members and then patients as quickly as possible. What are some of the major challenges you and other hospital systems are facing right now in both distributing the vaccines and also, of course, dealing with the current surge in COVID cases that we're seeing in our state and country?
Well, thank you. And thank you for having me tonight, Senator Lewis, and good evening, Senator Friedman and Dr. Bruno-Murtha. I want to take a step back to last March. The Cambridge Health Alliance system we're a health system that, represents and takes care of the disenfranchised, the communities of color, who were hit really, really hard in the spring. And as an organization, we were tested in the spring. And I think our organization came out stronger because of it. But now that we have really moved to this really exciting opportunity, and I'm hoping that this is the sort of the beginning of the light at the end of the tunnel for COVID-19. We created a vaccine task force that comprised of 20 different people of different disciplines within the organization. On top of that, in my role, many of the emergency managers at many of the Boston area hospitals and certainly hospitals in the greater Boston area, we have worked together for years and years and years. So we've had a relationship with each other that has been great. Well, there's a healthy competition amongst hospitals. I would say that the healthcare emergency management community, we're not a competitive group. We're really a group that is really geared towards trying to put plans that are consistent together. And I think that's important, that regardless of where you work in Massachusetts, all the healthcare systems, we're really doing things very similar. And we're trying to ensure that what we're doing is not only consistent for our patients, but ensures trust in the health system. So it ensures that regardless of where people get care, they're going to get similar care. We're going to treat people the same way. And I think with our staff, as we've worked with our partners at the State Department of Public Health, Secretary Sutter's office, and those at the Mass Hospital Association, many of us have worked together. So about what does this plan look like with the advisory committee that the state put together, that Senator Friedman's part of, and Dr. Bittinger, who has been the lead with this group. They've really sort of helped us formulate what does an ideal plan look like. Now, I would say that in the healthcare community, particularly, there are a number of challenges, I think, that have come with a vaccine like this. One, this is very new to us. We have had experience with having limited resources around vaccine, particularly with the H1N1 in 2009. But this one's different. And what's different about it is in the way it's the storage requirements that are around this. So we really convened a group that went off in different areas to sort of manage. One, what are our priority groups going to look like? So we took both federal and state guidance to sort of assemble those frontline providers who really are at most risk for interacting with COVID positive patients. And then you really begin to learn just the numerous other supportive departments that have a role in this and how we have to try to protect them as much as possible. And we were really unsure of how many people were actually interested in getting vaccinated. And I think as the vaccine has gotten closer, we've seen a lot more enthusiasm, and we've seen a lot more people. I would say a little bit of anxiety as well, but people who want to be vaccinated. And I think what we chalk that up to is that people want the vaccine, and so we are eager to get this rolling. But to sort of go back into our world a little bit, we needed to sort of put a plan in place with our pharmacy around how do we accept a vaccine that requires such low-level temperatures. Now, we've just learned through the State Department of Public Health, they're going to manage that for us, and then they're going to ship the vaccine to us, where we will then reconstitute the vaccine, and then we'll begin the process of vaccinating people. There are so in a regular flu clinic that we do every year for our employees, it's about 4 people that we involve in our vaccine flu clinic. This time around, there's 11 people. And so we knew some of the things that Senator Friedman talked about. We need to make sure that as we get people lined up, we've put people on a list so that as the priority groups come, we're trying to vaccinate only 1/3 or 1/2 of departments at any one time to ensure that whatever reaction the staff have, we can continue to operate the hospital, given that the hospital is currently, much like every other hospital in Massachusetts and likely across the country, is dealing with a surge that we're used to in December, but we're not used to having a pandemic on top of us. So we want to make sure that all of the staff who are being vaccinated in the priority areas, that we're not taking all of the staff at one time to vaccinate them. So we will be vaccinating people over a certain probably 8-day period to do this. And as we get people to come into our flu clinic, we're going to make sure that we get them registered. And that way, on the back end, our pharmacy team will be registering them onto a reminder system so that we can give them an automatic reminder 21 days for their second dose. And then our occupational health team will be implementing and putting their information into the state's immunization system to ensure that the state has good records that demonstrates just everyone that we are vaccinating in real time. We will send folks to our vaccinators once the pharmacy team draws up the vaccine and then hands it to our vaccinators, keeping in mind that as soon as we reconstitute and take that vaccine out of the refrigerator, we have only 6 hours to use all that vaccine. So we need to be very careful about how much we bring out at a time, how many people we bring to our clinic at a time. And then once the staff member is vaccinated, then we need to keep them for 15 minutes. And we're going to be keeping them in another area that is socially distanced to protect them. We're going to watch them for 15 minutes to ensure that they don't have any unanticipated reaction to the vaccine. And then we will let them go back to work. In the meantime, we're going to be giving them data or information based on a fact sheet that the FDA and Pfizer have put together around what the vaccine entails, as well as a sheet that people can report directly to the FDA on any unanticipated reaction that they might have. It's inside the hospital. We are also having within our risk management system, we are creating a system so that any employee who has any type of reaction that they did not anticipate or something a little different, they will be able to enter a risk report. This will allow not only the hospital to internally monitor our staff, but allows our occupational health team to follow up on the staff. And so through our vaccine task force, we have been looking at all the safety data that has been come out so that we can make a recommendation, not just what the FDA has been saying, what Dr. Fauci has been saying, but our team has been doing their own due diligence And we're asking our colleagues, based on the information that we have seen, that this is a safe vaccine to get. So our team has been meeting regularly, and we are going live tomorrow with an all-staff Google Meet that allows all of our staff the opportunity to hear from our experts, both on the clinical safety, and gives them the opportunity to ask questions. It's going to be a live format, and we're going to record it so all staff can hear it. And we want our staff to ask many questions. I know they're out there. And we want to make sure that we're being as transparent as possible. And most importantly, I want to thank the advisory committee for putting the whole community approach and creating a culture of equity. This ensures that everyone who comes into contacts with any of our COVID positive patients or any of those units are truly being treated just like anyone else who comes into contact, and that we're not really siloing people into groups and having them wait where they're going to get the same level of benefit as anyone else who is at risk. So, and I'm happy to hear any questions anyone has as well.
Great. Thank you so much, Christian. You've given us a lot of insight into how the rollout is going to be operationalized and all of the complicating things, that you and others are having to think through. I want to give a shout out to Tom Dalton and Emily Grana from my office for all their hard work putting together also tonight's community conversation. All right. So, Tom, I think it sounds like we've got a lot of questions coming in from our audience. So if we could put the first question up so that everybody can see it. And here's our first question. And this refers to, obviously, as we can see, daycare providers, early ed providers. And so this is actually a question I've seen coming in from other folks as well. In fact, we got a question earlier today on Facebook from a librarian also who was having, essentially the question is, is it an honor system, or how does somebody basically validate that they are in a particular group that would be in phase 1 or phase 2? And I don't know who the right person is to answer that. Senator Friedman, if you have some insights into that, maybe start there.
Sure. I mean, I think in terms of daycare providers, if you're a licensed daycare provider, the state knows who you are. And if you're a police officer, the town knows who you are. So for many of these pretty much, essential workers, there is some ID or some identification that can be used that says, yes, you are a daycare provider. We know about you. You're licensed. So I think that will address that issue as the phases roll. I mean, hospitals are easy because they're employees, right? So it's not an issue. And I think for first responders, it's not an issue. And I would think that for daycare providers, teachers, people who work in those sectors, and transit workers, those are all people that, have some connection to a group or to a licensing board that I think would address that issue.
Excellent. Thanks. Thank you, Lauren, for that question. And one of the things I'll add at this point is we actually both Senator Friedman and I have heard a lot of concerns from our daycare early education providers, throughout this pandemic. We know it's been an incredible struggle for you, and we are pushing not just for the vaccine prioritization, which is, we're very pleased that you're in phase 2, but also for increased access to testing as well, which also continues to be, of course, very important. All right, let's see if our next question, all right, from Gail, an adult child with CHD. Okay, so this is another sort of related to the previous question in terms of, again, knowing prioritization, when somebody is going to be eligible to be vaccinated, and then sort of, do they have to be proactive or will they be hearing from their physician? Anybody in a position to take this question?
Well, I think one of the things that we will be doing based on state guidance as well is we will be providing guidance to our primary care providers as well about who can be vaccinated. And I think the most important thing is that most people have a relationship with their pediatrician or their primary care doctor who has a relationship and knows them. And I think in many of those cases, when we are providing the vaccine to them, that is really the best place to, if you have a concern, that I think they're the best people to ask these questions, but they're also the ones who know you the best and are likely to the ones to give you advice, recommendations, and they will be able to help you determine whether you're in the group that's appropriate to be vaccinated now, or maybe you need to wait a little longer. So I do think it's important that we give our primary care providers the important guidance that they're going to need to make those decisions, but it's equally important that the public is able to have that conversation with their doctor directly as well.
Great. So it sounds like.
Yeah, and I would.
Yep, go ahead, Senator Friedman.
Well, I would just add to that this is part of what the rollout has to address, and this is something that the advisory committee spoke a lot about, and that is communication. How do you communicate to people? First and foremost, that this is a good vaccine and they should get vaccinated and they can trust it. And that in and of itself is an activity that's going to take a lot of focus, because you heard the numbers, and concentration. But also the state, at the state level, has to direct both the local boards of health and the public on when it's their turn, when the vaccine is available for a group of people, and then they have to help the communities get the vaccine so that they can begin to vaccinate separate and different groups. But that's really needs to be part of what the state rollout is.
So probably fair to say, bottom line right now, the current plan, and I think Tom posted the graphic in the chat that Senator Friedman referred to, in terms of who's in phase 1, who's in phase 2. Those are broad groups. And the key is that we know there's going to need to be a lot more communication to the public, to specific populations in the coming weeks, that will give people more information about when to get vaccinated and what to do. But I think Christian's advice is great advice. You can always reach out to your primary care physician, and he or she will be able to guide you. Let's go to our next question. Oh, yes, good one, because we should have probably added, right, as far as I think, if I'm right, the Pfizer vaccine is only for 16 years and older. I don't know what Moderna will be, but what about for younger children? So under age 16.
So I could respond. I do know that Pfizer is putting together a study right now of kids 12 through 15 years of age to try and get more information in the younger age group. I am not aware that children younger than 12 are being studied at this time.
So what does that mean, Dr. Bruno-Murtha? So let's assume right now, I guess, children under 12 do not get vaccinated. How does that play into herd immunity if you have that part of the population that is not going to be vaccinated?
Well, yeah, I do think it's important that we do these studies in pediatrics. Like most clinical trials, certain populations don't get included early on. And children are often not included early on until there's demonstrated efficacy and primarily safety in adults. So now that we have this first trial demonstrating efficacy and safety, there will be more clinical trials looking at other populations that have not been studied. For example, pregnant women were not included in the Pfizer trial. Having said that, both the American College of Obstetrics and Gynecology and the Society for Maternal and Fetal Medicine are still recommending that all pregnant women have a conversation with their provider and really discuss the pros and cons of getting vaccinated. And most obstetricians are leaning toward vaccinating pregnant women.
Thank you. All right. I think we're ready for our next question, Tom. A long one. All right. Thanks, Mary Ann. Okay, so you're referring to current behavior and despite all of the and Senator Friedman and Dr. Bruno-Murtha both reinforced this, that even though the vaccines are coming, that doesn't mean we can let our guard down in terms of social distancing, wearing masks, and other public health guidance. So I guess the question is sort of like, how do we continue to get through to people that, we are not out of the woods yet, certainly for the next at least 6 months, right? 4 to 6 months, we're going to have to continue with these same public health restrictions.
Yes, that's absolutely correct, Senator Lewis. And, I would say that it's frustrating when there's some people that don't follow the public health guidance because it puts others at risk. And, it's a difficult situation. You could try and have a conversation with people. Sometimes people don't want to hear what you have to say. So that could be, citing a problem. So I would say for folks that are disturbed by the fact that we don't have 100% compliance with all the non-pharmaceutical interventions and public health measures, obviously you're concerned about that. I would say that you should probably strongly consider getting vaccinated as soon as you possibly can, so that you optimize your protection and that you are essentially immune. And that's what I would just strongly recommend.
And the other thing I would add, so I think the key is that obviously the communications from community leaders, healthcare leaders, as you've heard tonight from our panelists, needs to continue, that even while the vaccines are being rolled out, we need to continue the same public health measures we have been for most of this year. I would also add that the legislature and others continue to be in close communication with Governor Baker and Secretary Sudders about potentially taking further steps to help prevent the spread. And Governor Baker did slightly roll back the state's reopening as of Sunday. That was an important step, recognizing the increase in cases. Boston Mayor Marty Walsh just earlier today announced some further restrictions and rollbacks for the city of Boston, and I expect we'll see that in some of the surrounding communities as well. So there may be further action, in the meantime, even while the vaccine's already here, that needs to help control the rapid spread of the virus that we're seeing right now, unfortunately. Do we have another question, Tom? All right, from Carol. Okay, so I think this question, I think Carol's mentioning Carol and David. Will we be in the second group or the third? Okay, so I guess this is a case of a couple who are seniors and actually have comorbidities. So it would seem to me they would be in probably in the second group. Does that seem right to you all? Maybe Cindy?
I think they would actually be in phase one, because if they have 2 or more comorbidities, and also the folks that they deliver to, hi Carol, are people also who are, a number of them would be considered in congregate care, so, or in vulnerable situations, and many of those people have 2 or more comorbidities. So the one thing to remember about the phases is there's a lot of overlap. Okay, there's a lot of people that work in healthcare, direct care, for instance, that have 2 or more comorbidities, right? There are people who work in one sector and live in a high, maybe a high risk community, right? And those people are going to get vaccinated and then they're going to go back to their community. So, we make these phases, but there really is a significant amount of overlap between a number of them.
I also tell our staff here who, are anxious, particularly is, they're further down on the list, that we've been in COVID for 9 months without a vaccine. And, your best effort is your mask. Your mask really is our best protection at this point. So continue what you're doing, be safe, continue social distancing. And, patience is really hard when there's something exciting like a vaccine on the horizon. But I think we do need to remember that, we were without a vaccine for 9 months, and we continued to meet the needs of those that we care most for. And I would ask that we keep that work up. And even after the vaccine you've been given the vaccine, we still need you to help demonstrate to others that we are still in this, and we still need to be masked up until we get through the most of the people who have been vaccinated and are safe to take off those masks, which we all want to at some point.
And great point. And I think we should also emphasize, maybe Dr. Bruno-Murtha, if you want to just make sure I got my numbers, the timing right here. Once you receive the first dose, you then have to go back 3 to 4 weeks later, right, for the second dose. And even then, it's another 4 weeks or so until you actually have immunity. So do you want to just confirm that for folks? So there's a span of time before you even personally have immunity.
So with the Pfizer vaccine, the second dose is at 21 days, and actually a week after the second dose, there's evidence of immunity. So it's not that long. So basically a month after you start the Pfizer series, you will likely be immune. Now, keep in mind that there's always some people who do not respond to vaccines, even though this vaccine was very effective. 95% of the participants had antibodies detectable, which is really astonishing. But there's always some people that do not respond to vaccines. So just because you get the vaccine doesn't mean you could be careless and carefree, because we do not know if you're going to be among those 95% who actually respond.
Got it. Okay. All right. Well, thank you. And thank you to Carol and David also for being making Meals on Wheels deliveries. We really appreciate you helping out our homebound seniors and those with disabilities doing that. Thank you. So let's go to our next question, Tom. And I think it may be the one we just answered, which is sort of that Rachel asked. So I think we have answered that question. So thanks. I think we can go ready for the next one. Okay, interesting. So this is sort of again on the theme of when somebody would be eligible to be vaccinated.
I'm happy to respond to that. So again, in the clinical trials, patients on medications that cause them to be immunocompromised weren't really included. They did include some stable patients with HIV and some stable patients with hepatitis B and hepatitis C. So we don't have a whole lot of data on immunocompromised individuals. Nonetheless, the Advisory Committee on Immunization Practices is recommending that immunocompromised patients do in fact get vaccinated. You may be among the few patients who may not have a robust response, but nonetheless, you should still get vaccinated.
Great. Okay. From Keith. Oh, very interesting. So this issue here of people who've had COVID, recovered, but continue to have ongoing symptoms. I think we all know people who fall into this category, and it's really, really upsetting to see what people have been going through even after they're supposedly have recovered from the illness. So how do we have any sense of whether one or more of these vaccines would, how they might help folks who are in this category, so-called long haulers?
So in the Pfizer clinical trial, patients with a known clinical diagnosis of COVID were actually not able to participate. Having said that, there were some patients who did not have a clinical diagnosis of COVID who ended up having asymptomatic infection and ended up having positive serology. And among those patients, they weren't a lot, maybe a few hundred of those patients who had serologic evidence but no clinical history, the vaccine efficacy was equivalent in that population. And there were no signals in the study that the vaccine enhanced disease in patients who previously were infected with COVID-19. So I can't really answer the question, but there's some reassuring information that the vaccine will not exacerbate any type of medical condition in patients who have antibodies to SARS-CoV-2.
And just to build off of that, I guess we don't really know yet if somebody has actually been infected with COVID, they've recovered, what sort of longer term immunity that individual has. Is that right?
There are some studies coming out now showing that some people still have antibodies 5 months out. So this is something that will be continued to be monitored closely, and also in the vaccine recipients, how long their antibodies will persist remains to be determined. Even if the antibodies wane, it does not mean they lose protection. That happens with a lot of vaccines. Over we lose our detectable antibodies, but if exposed to the organism, the virus or the bacteria, our immune system has memory cells that can often respond and start producing antibodies and responding. We call that an amnestic response. So a lot of this information will be forthcoming in the next several months.
Okay. Thank you for that. Tom, back over to you from Sue. Okay, so question about prioritization for those who are in congregate settings. I think we did, Senator Friedman, you did talk about that in yours, so maybe if you could just review that one more time.
Sure. Sure. The congregate setting folks are in phase 1. So they are considered some of the most vulnerable because they live together.
And maybe just give a sense, sorry, just for folks who may not be as familiar with congregate settings, what are some of those different settings besides, nursing homes?
Shelters, correctional sites, group homes, assisted living, those kind of, well, actually, assisted living would not be included in congregate settings, but group homes would definitely be considered. Homeless shelters, places like that.
And again, that's phase 1, so that's highest priority. And the timing that we're expecting for phase 1 is next
over the next couple of months. I think depending on how things roll out, there'll be I think they're looking at December and January for that first phase into February. And again, those are rough because we need to really depends on how many dosages we get. And doses we get, and also we have to remember that you need 2. So if you get one in late December, we need to track and make sure that there's going to be that second dose is going to be available. So, but those are the general timeframes that they're looking at.
Great, got it. All right. Let's see. Difference. We're going to get into the pharmacology of it here between the Pfizer and Moderna vaccine. What are the differences? I suspect this is a Dr. Bruno-Murtha question.
Hi, Rachel. Thank you for your question. Yes, I'm happy to respond to that. So both the Pfizer and Moderna vaccines are based off the mRNA platform, so they're very similar in the way they work. They do have different cold chain requirements. The Moderna vaccine is not as stringent as the Pfizer vaccine, so logistically it's going to be much easier to administer. There's also a difference in the amount of RNA each virus that's in each vaccine. The Pfizer has, I think, 30 micrograms, and I think the Moderna has 100 micrograms of RNA in it. And the timing of the second dose also differs. So Pfizer's 21 days, the Moderna's 28 days. But they work by the same mechanism, and in many respects are similar. And we'll know this coming week whether the efficacy and safety for the Moderna vaccine mirrors what we're seeing for Pfizer. But based on preliminary information, the data is just as good.
That sounds very promising. Might be a good time. I don't know if somebody in the audience asked this, but it might be a good opportunity, given what we're talking about right now, to maybe share a little bit of information with us about what we expect might be some of the other vaccines, that we know are also likely to come online. I know they obviously still have to go through the same process with review by the FDA, but I know some of those vaccines do work quite differently. So that maybe you could just share with us a little bit about what those one or more of those vaccines, how they may differ from Pfizer and Moderna, and just what we need to know about that. Because some people maybe end up getting those vaccines, right?
So the other platforms that are being studied are there's a Oxford vaccine that's looking at an adenovirus as a vector, and also the Johnson & Johnson is also an adenovirus type vaccine that uses a virus. And these are viruses that they don't really make us sick. They're either not pathogens, or they're altered in some way so they don't make us sick, but yet they provide the instructions to our immune system to produce a response, to produce an immune response. And preliminary data for both of those vaccines is also very reassuring. Other platforms where they're using protein technology, more traditional type vaccines with adjuvants are being studied. So there's likely to be several different platforms and several different vaccines, maybe up to 6, available in the next year or so.
All right, great, thank you. Let's go, Tom. I think it looks like we do have several more questions. Okay, thank you. This one from somebody who did have COVID already, and hopefully you're better now. Taking the vaccine if you've already had COVID.
So it's a great question. So the recommendations are to have the vaccine even if you had a prior history of COVID, primarily because we just don't know the durability of the antibodies from natural disease. Having said that, in our first phase at the hospital, we are not administering the vaccine to our staff who have had COVID in the preceding 90 days, because we know that reinfection in the first 90 days after COVID-19 diagnosis is very, very rare. So given that the vaccine is very limited right now, we're preferentially using the vaccine for people that we believe are susceptible to disease. And we will vaccinate our staff that have been previously infected when our supply is improved.
Great, thank you. Okay, another very important question, where this is around whether it's voluntary or mandatory, right? I know a lot of people have questions about that. So Senator Friedman, maybe you want to kick this off in terms of what the state's approach to it will be, and then maybe there's some nuance to that we can discuss.
Sure. There's no requirement right now that people be tested. Now, private companies can do what they want. Can't stop that. But the state has no plans to require somebody to get a vaccine. But I read that question as, is this a yearly vaccine that one would need to get, like the flu?
Yes.
And I don't, I've read things about, is it a mumps type vaccine or is it a flu vaccine? So maybe Dr. Bruno-Murtha or Christian can answer that.
So at this time, we do not really answer to that. These are studies that will be ongoing. We will see the durability of the antibodies that are produced. The patients or the participants, I should say, in the Pfizer study are going to be followed for 2 years. So there's going to be more data emerging from this study. So we will know the durability of their antibody response. And it's that information that'll be helpful and insightful in terms of us determining whether there's going to need to be a booster and how often the booster is going to need to be. So stay tuned, more information coming in this area.
Just to clarify, we don't expect it's like flu in the sense that the virus changes every season, and so you actually need a different vaccine in order to be protected from that seasonal flu vaccine. Is that am I correct in that? The virus is more stable than that.
That's true. The virus is more stable. We still give the flu vaccine. Sometimes from year to year, the flu vaccine actually doesn't change because we're expecting the same type of circulating strains, but we still vaccinate annually just because we know that the immune response wanes after a year.
Okay, so key information then, we should all get vaccinated when we can, but we won't know for a while whether and when we need to be vaccinated again, but we will know more as we continue to track the studies. And for those who are concerned, if you are, it's not a mandatory vaccination. This will be will be voluntary again, but we're hoping that close to 100% of the population does choose to be vaccinated. Let's see, Tom, I think we have one or two more questions from Gail. Okay, great. A very important question as well, which kind of speaks to the supplies of the vaccines. We are getting them from the federal government. So how will that be split between states, and are we competing with other states? Not sure who's in a position to.
Well, I think one of the good things about this is that the way the federal government through McKesson is managing this is they are with as the vaccine is being distributed out to all of us, they are also sending all of the supplies with it. Now, it doesn't come with gloves and some of the other things, but it does come with the main components: the needle, the syringe. There are other key components that, regardless of the vaccine, it is going to be distributed with the vaccine at the same time. With the Pfizer being a little bit different, McKesson is sending it out, but it may come out right behind the vaccine. We're preparing to have all of our supplies on hand. Is the minute it's here, we're given the go, we will begin vaccinating. But I think the public should know that the federal government has been actually working for the better part of probably 6, 7, 8 months to bring supplies together, and that the expectation is through McKesson, the distributor that's moving all of the supplies, they will all of that supply. So we should not be competing.
Yeah,
we should not be competing for supplies.
My understanding is that it actually comes as a package. So you get the doses and you get the accoutrements that you need to give it. My also understanding is that the federal government is distributing vaccines based on population. So we know what we're getting based on our population, and that I think that's how they've said they're going to be doing it. So just in terms of, do you have a friend in Wyoming and you can get more than you can in Massachusetts? I think at least what they've been very clear is that it's being done by population.
Okay, good. Good. All right. So I think we have one more question. So we're going to take that now. But if anyone, we still have a little more time. So if anyone still has anything else you want any of our panelists to respond to, please go ahead and just type it into the the Facebook comments. All right. So from Jeanette, once you are vaccinated, how will somebody demonstrate that they've been vaccinated, and will that potentially be required to demonstrate you've been vaccinated, for travel purposes or even some companies? So that's a really interesting question as well. Anybody?
Yes, thanks, Jeanette, for the great question. Yes, there will be a vaccine card that you will be issued at the time you receive the vaccine. In addition to the card, you will receive some patient information about the vaccine and what you need to know in terms of efficacy, safety, who to call if you have a problem. There's also, and something we haven't touched on yet, there's also going to be a very robust surveillance system for monitoring adverse events associated with vaccination. These clinical trials were fairly large in size. However, when you're talking about very rare adverse events, you're talking about 1 in a million. These clinical trials had 30 to 44,000 participants, but certainly not a million. So now that we roll out vaccinations very quickly, we will get to that million very soon across the country. In order to identify a safety signal, we have to have a robust surveillance system in place. And we actually do. We have many surveillance systems in place for vaccine safety. The VAERS system, there's also other systems out there, but there's actually a new system specific for the COVID vaccines that is going live with this. It's referred to as vSafe, and it's an opt-in program, and it's an application for smartphones whereby if you register, you will receive a text reminder for the first 7 days daily after you receive your vaccine, inquiring about how you're feeling, are you having any problems, and to give feedback. And then that surveillance decreases to weekly for the first 6 weeks and then quarterly thereafter. And then when you get your second dose, it totally resets on a similar schedule. And if you have something that's concerning to the CDC, who will be monitoring this platform, they will reach out to you and call and inquire and ask more questions. So there is a very robust system in place, and this is new. And I would encourage everyone to participate in this. This is the fastest way we can ascertain whether there are safety signals that the clinical trials were not large enough to detect. So I would encourage everyone to participate in the vSafe program. If you have a smartphone with text capabilities, it would be a huge public health effort. And it'd be very, very important in terms of instilling confidence in the public that this vaccine is in fact safe and we are not detecting safety signals.
Super important that we track that. All right, I think a couple more questions just came in from Rachel. Great. Will the vaccine be free of charge? My understanding is yes. Is that correct? I'm seeing nodding heads. So no one has to pay for it, no co-pays, no surprise billing. Good. That's excellent news. All right. And requirement for students to get the vaccine in order to attend school. Obviously, we do require students to be vaccinated for other diseases in order to attend school. There are some exemptions for that, but do we have any thoughts around that? I don't know if it's too soon to know.
I think it really is too soon to know. I mean, remember, right now, nobody under 16 is getting the vaccine, so it's not something that we can require. So I think that is all, in the future.
Yes, and we are not requiring it for healthcare providers, and I think it's not fully FDA approved. It's got an emergency use authorization. So as a result, I think we look at mandatory vaccination differently. It'll be interesting to see how colleges and universities vet this vaccine for future administration. But because it's under an EUA, I think it might be challenging for them to mandate it.
But I also think that is a bit of a separate issue right now, like mandating vaccines, mandating, requirements for work, et cetera, really are more of a kind of policy issue or and we're not there yet. So I wouldn't worry about that. I'd worry about keeping your mask on, social distancing, and getting the vaccine.
I think that's a great place to wrap up. So I want to thank our audience for joining us for terrific questions. We covered a lot of ground tonight. Hopefully everyone feels more comfortable about where we are and where we're headed in our communities, in our Commonwealth. We're so lucky to have our expert panelists tonight. Thank you so much to Dr. Bruno-Murtha, to my friend and colleague, Senator Friedman, and to Christian Lanphere. Really, really appreciate your time and expertise tonight. And if anyone has further questions or concerns, feel free to follow up with my office or Senator Friedman's office. We'll be sure to track down further information and answers for you. Stay safe and healthy, and happy holidays, everyone.